So, of course, I would check the patient's chart and make sure I know everything about them, and I would perform hand hygiene. I would know from the chart, maybe from the sign on the door, if they're on any precautions. This is what I'd put any PPE on, but I don't need anything for this, so I'm gonna go on in, knock knock. Okay, hi Mr. Smith. You're needing a catheter today, a foley catheter. So I'm gonna get you ready, and then I'm gonna insert that for you. Okay. Can you just tell me your name and date of birth? All right, thanks. Yep, that's right. All right. So first, what I'm gonna do, Mr. Smith, is I'm going to get you cleaned up a little bit, and then we'll get started with the procedure.
Could you imagine if you used the punch dogs on a real patient and then notice I really
How are you doing today?
real patient, but
Doing good?
like
Doing
I'm
good.
not my supplies for you, whoever you are.
Okay, so right now I just have clean gloves on because this is just a clean procedure. Okay,
You know, driving.
so Mr. Smith, I'm just gonna clean your perineal area with some soap and water to get you all ready and clean. So I would have a wash basin too. I would have a wash basin, but we don't have an extra one right now. I would also have a pad because we don't want to have to change the bedding and everything. So what I would do is I would go ahead and I would slide a pad under that's going to absorb any extra water, so I don't have to clean the sheets. Okay, so now I would have my wash basin with some warm soapy water. I always test it first, make sure it's not too hot or cold, like that. All right, I'm gonna clean you up now. And start here. Oh,
No, so like, what
almost forgot. Gotta do the
like, you know, like
correct.
his body, and she's just like, oh, I'll let you have him back if you give me $10,000, like something like that. So.
Okay, we're gonna pretend I didn't just start cleaning him, so we'd do like this.
Like by like
Go around in a circle, and then dip it again. Now I'm using another side, this back side. Do it again.
They're legally married.
And
She's going to
out, other way. All right, very good. And wash that soap off, changing the fold of the towel each time. Okay, and then I would grab a new towel, pretend this is new, and make sure to pat it dry, let the area dry. Okay, very good. Okay, let's cover you up now a little bit. All right, so get rid of this.
I want to go over
Take off my clean gloves. All right, Mr. Smith, so we are going to get you ready to put the foley catheter in. I'm going to be inserting it into your penis. You might have a little bit of discomfort, but it shouldn't last long. And let me know if you do feel any intense pain, because that wouldn't be normal. Just let me know, and I'll try to make this as quick and as comfortable as we can. Okay? All right, so I would uncover only the area that I'm working with here. I'm gonna raise the bed a little bit more. Okay, so I'm gonna perform hand hygiene because I was cleaning him up. Okay, so now I'm going to open the sterile kit open. I would be opening it away from me. Normally it would be folded better, but I'm not good at putting it back. So holding only the outer edges, positioning it like that. Okay. So next I would grab my gloves. I'm not working with a lot of space right now, so I'm gonna do this. We're gonna pretend that I already have this here. got room to work with it. I guess it's okay if this touches this though, because it's all sterile. So we're good. Okay. But the back of the gloves paper isn't sterile because now it's touching the table. So part of it's sterile. Okay. I'll try to not turn my back to the sterile field. I'm going to start setting up a sterile field over by Mr. Smith.
Maybe use this person here to practice.
He's really a little up high. Mr. Smith, lower your legs a little bit for me. Oh, thank you. Okay.
My son's skating early this morning. Hear what? My son falls because his teacher spitting on another student. I was like, oh god. Did she say why? Huh? Did she say why? She just said he just walked over there and he's just like spitting. He's like, okay. He thinks everything is a game. Oh. Everything is a game. I can see it. I can visualize it.
Okay.
Everything is a game.
So, what I'm going to do now is start to prepare everything. Going to just lubricant. I would just put it all in this tray here. Okay, that's done. And I'm gonna remove this. Throw it in the garbage. And I'm gonna rest the tube that's going to be inserted into him into the lube.
I identify him. I don't know who it is. Who your name is.
There we go. Okay. So I'm going to take this, open it up, the iodine solution, and put that on the cotton balls. Okay, that's all done. Okay. Also going to get the saline and hook it up to this, to the bag, or the tubing. It's gonna go to this one. Okay. Okay. So now, Mr. Smith, I'm going to clean your private area again, just with a different solution. Okay. I'm doing circular motions, starting at the top, going towards the bottom. Okay. Very good. Okay, so now this area is clean. I'm ready to insert the catheter. Okay, Mr. Smith, again, you're going to feel a little bit of discomfort, but it shouldn't last long. Let me know if anything feels extreme, okay? All right, so I'm inserting the tube now. It's got lubrication on it. All right. It's going in, and I'm going to keep inserting it until I feel a return of, or I see a return of urine. Oh, and I see a return of urine. So I'm gonna insert it another 1 to 2 more inches. Okay, very good. All right, this hand is now just clean, but I'm almost done with my sterile procedure. Okay, so now I'm going to put in the sterile solution that inflates the balloon in there. So I totally push it all in, and then I gently tug a little bit just to make sure that the balloon's sitting where it should. Okay, so now we're not sterile anymore. I I can go ahead and take this off. I would dispose of this in the correct place. Oh, also what I would do now, I don't want to hold on to this because I don't want anything to, well, normally I'd be holding on to this, making sure it's not going anywhere, but I want to secure the tube. Here's mine. Okay, so in real life, a stat lock would be the best because it's going to allow the tube to like move around or whatever and just still be safe and not pull or tug. But this is all we've got right now, so we'll pretend this is a stat lock. So secure that to his leg, making sure that there's some slack, so if he moves around, it's not gonna pull out. At this point, I would rip off this, but I want to practice and use it again, so we're not gonna rip it. And pretend I ripped it and threw it away. So hook this up to the side rail, always have it at a position below the bladder, make sure there's no kinks, and I would dispose of all of this. How do you feel, Mr. Smith? Are you feeling okay? Feel comfortable? Okay, good. Okay, so I'll get rid of my sterile gloves. I'm going to cover you up now and get your bed to the lowest, safest position. Okay, is there anything else you need right now? Okay, well, I'll be back in a little bit with your medication. Okay, here's the call light. All right, and just call if you need anything, okay? I'll see you in a little bit. And then